Which tube must always be drawn first to maintain sterility? A. Lavender. B. Light blue. C. Yellow, blood culture. D. Green. Answer: C. Yellow, blood culture. Blood culture tubes are collected first to avoid contamination. Additives from later tubes could interfere with bacterial growth. What additive is found in light blue tubes? A. Heparin. B. Sodium citrate. C. EDTA. D. Sodium fluoride. Answer: B. Sodium citrate. Light blue tubes contain sodium citrate, which preserves clotting factors for PT and APTT tests. Lavender tubes are primarily used for A. CBC tests. B. Chemistry panels. C. Glucose tolerance tests. D. Coagulation studies. Answer: A. CBC tests. Lavender tubes contain EDTA, which prevents clotting and preserves cell structure for hematology. Which tube comes immediately after light blue in the order of draw? A. Green. B. Red. C. Gray. D. Lavender. Answer: B. Red. After coagulation tubes, serum tubes like red or gold are collected for chemistry and serology. Which additive in green tubes prevents clotting by inhibiting thrombin? A. Potassium oxalate. B. Heparin. C. EDTA. D. Sodium fluoride. Answer: B. Heparin. Green tubes use heparin, an anticoagulant that inhibits thrombin and preserves plasma for chemistry. What is the correct order of draw for coagulation, serum, and hematology tubes? A. Lavender red light blue. B. Light blue red lavender. C. Red lavender light blue. D. Red light blue lavender. Answer: B. Light blue red lavender. This order prevents additive contamination: coagulation first, then serum, then hematology. Gray tubes contain which additive combination? A. EDTA and sodium citrate. B. Heparin and sodium fluoride. C. Potassium oxalate and sodium fluoride. D. Sodium citrate and EDTA. Answer: C. Potassium oxalate and sodium fluoride. Gray tubes preserve glucose using sodium fluoride and prevent clotting with potassium oxalate. Which tube is used for toxicology and therapeutic drug level tests? A. Gold. B. Green. C. Red. D. Lavender. Answer: C. Red. Red tubes without additives are preferred for drug testing because no anticoagulant interferes with results. What is the last tube in the standard order of draw? A. Light blue. B. Gray. C. Lavender. D. Green. Answer: B. Gray. Gray tubes for glucose and alcohol testing are collected last to avoid interfering with other tests. Which color tube should be avoided before blood cultures? A. Green. B. Lavender. C. Red. D. Any other tube. Answer: D. Any other tube. Blood cultures must always be drawn first to prevent contamination from any additives. Which additive is present in lavender tubes? A. Sodium citrate. B. EDTA. C. Heparin. D. Sodium fluoride. Answer: B. EDTA. Lavender tubes use EDTA to prevent clotting and maintain blood cell integrity for hematology. Serum separator tubes, SST, gold top, contain A. Heparin. B. Thrombin. C. Gel and clot activator. D. Potassium oxalate. Answer: C. Gel and clot activator. SST tubes use a gel barrier and clot activator to separate serum from clotted cells for testing. Which tube should be collected before a lavender tube? A. Gray. B. Red. C. Yellow. D. Green. Answer: D. Green. Green tubes come before lavender to avoid EDTA contamination that could affect plasma chemistry tests. What test requires a light blue tube? A. CBC. B. Point/INR. C. Glucose. D. Electrolytes. Answer: B. PT/INR. Light blue tubes with sodium citrate are used for coagulation studies like PT, INR, and APTT. Which tube is required for blood alcohol testing? A. Gray. B. Lavender. C. Red. D. Gold. Answer: A. Gray. Gray tubes contain sodium fluoride to prevent glycolysis and preserve alcohol concentration. Which comes first, green or lavender tube? A. Green. B. Lavender. C. Either is acceptable. D. Gray. Answer: A. Green. Green is drawn before lavender to prevent EDTA contamination of chemistry specimens. Which tube is required for blood type and cross-match? A. Yellow. B. Lavender. C. Red. D. Green. Answer: B. Lavender. Lavender tubes with EDTA preserve red cell morphology, essential for blood bank testing. Which additive prevents platelet clumping and preserves morphology best? A. Heparin. B. Sodium citrate. C. EDTA. D. Sodium fluoride. Answer: C. EDTA. EDTA is the most effective additive for preventing platelet clumping and preserving cell shape. What happens if a lavender tube is drawn before light blue? A. Accurate results. B. Clotting risk. C. Coagulation test error. D. No effect. Answer: C. Coagulation test error. EDTA contamination can falsely prolong clotting times, invalidating coagulation studies. Which tube is required for ammonia level testing? A. Red. B. Green. C. Lavender. D. Gray. Answer: C. Lavender. EDTA lavender tubes are commonly used for ammonia testing, with samples kept on ice. Which tube is used for electrolyte panels? A. Light blue. B. Green. C. Gray. D. Yellow. Answer: B. Green. Green tubes with heparin are standard for plasma chemistry tests, including electrolytes. Why must blood cultures be drawn first? A. They contain heparin. B. To prevent clotting. C. To avoid contamination. D. They have no additive. Answer: C. To avoid contamination. Sterility is crucial, so blood cultures are collected first before other tubes. Which additive is in royal blue tubes? A. Sodium citrate. B. EDTA or heparin. C. Potassium oxalate. D. Sodium fluoride. Answer: B. EDTA or heparin. Royal blue tubes are trace element free and may contain EDTA or heparin, depending on the test. Which test cannot be done from a gray tube? A. Glucose. B. Alcohol. C. CBC. D. Lactate. Answer: C. CBC. Gray tube additives damage cell morphology, making them unsuitable for hematology. Which additive is in yellow ACD tubes? A. EDTA. B. Acid citrate dextrose. C. Sodium fluoride. D. Heparin. Answer B. Acid citrate dextrose. Yellow ACD tubes are used for genetic and DNA studies, preserving white cells. Which comes immediately after blood cultures in the order of draw? A. Lavender. B. Light blue. C. Green. D. Red. Answer B. Light blue. Light blue tubes for coagulation studies come directly after blood cultures. Which tube requires a 9:1 blood-to-additive ratio? A. Red. B. Green. C. Light blue. D. Gray. Answer C. Light blue. Sodium citrate tubes require a strict 9:1 ratio for valid coagulation results. Which color tube is used for lactic acid testing? A. Gray. B. Green. C. Lavender. D. Yellow. Answer A. Gray. Lactic acid tests use gray tubes with sodium fluoride to prevent glycolysis. Which tube is best for plasma chemistry tests? A. Red. B. Green. C. Lavender. D. Gray. Answer B. Green. Green tubes yield plasma quickly and are ideal for chemistry assays. Which test requires no additive tube, plain red? A. Drug levels. B. CBC. C. Point/INR. D. Glucose. Answer A. Drug levels. Plain red tubes are used for therapeutic drug monitoring to avoid additive interference. Which tube is used for lead testing? A. Lavender. B. Royal blue. C. Green. D. Red. Answer B. Royal blue. Royal blue tubes are trace element free, preventing contamination for heavy metal testing. Which comes last, gray or lavender tube? A. Gray. B. Lavender. C. Either is correct. D. Green. Answer A. Gray. Gray tubes are always collected last to avoid interfering with other tests. Which additive is present in green tubes? A. Lithium or sodium heparin. B. EDTA. C. Sodium citrate. D. Sodium fluoride. Answer A. Lithium or sodium heparin. Green tubes contain heparin salts that act as anticoagulants for plasma chemistry. Which tube is used for ESR testing? A. Red. B. Green. C. Lavender. D. Light blue. Answer C. Lavender. ESR requires EDTA tubes to maintain red blood cell shape during sedimentation measurement. Which additive stabilizes glucose for up to 24 hours? A. EDTA. B. Sodium fluoride. C. Heparin. D. Sodium citrate. Answer B. Sodium fluoride. Sodium fluoride in gray tubes prevents glycolysis, preserving glucose for extended testing. Which tube is drawn before a green tube? A. Light blue. B. Gray. C. Lavender. D. None. Answer A. Light blue. Light blue comes before green to ensure accurate coagulation results without heparin contamination. Which tube is most sensitive to underfilling? A. Lavender. B. Green. C. Light blue. D. Red. Answer C. Light blue. Underfilling alters the 9:1 ratio in sodium citrate tubes, invalidating coagulation studies. Which tube is used for lipid panels? A. Red. B. Gold, SST. C. Green. D. Lavender. Answer B. Gold, SST. Serum separator tubes are used for lipid and chemistry panels, providing clear serum samples. Which test requires protection from light and may use a green tube? A. Bilirubin. B. Point/INR. C. Ammonia. D. ESR. Answer A. Bilirubin. Bilirubin is light sensitive and samples are protected from light in either serum or plasma tubes. Which tube is required for HbA1c testing? A. Gray. B. Lavender. C. Red. D. Green. Answer B. Lavender. HbA1c is measured using EDTA lavender tubes, as whole blood is required for analysis.